안녕하세요. 청신국제중학교 2학년 2반 6번 김시연입니다. 오늘 저는 저의 진로인 수의사라는 직업에 대해서 한번 소개해 보도록 하겠습니다. 우선 첫 번째로 수의사는 동물의 질병을 진단하고 치료하며 예방과 연구를 담당하는 전문가입니다. 사람에게 의사가 있듯 동물에게는 수의사가 있죠. 하지만 수의사는 단순히 동물만 돌보는 직업이 아닙니다. 원헬스, 즉 사람, 동물 환경이 건강이 서로 연결되어 있다는 개념 아래 수의사는 인간 사회의 건강과 안전을 지키는 매우 중요한 역할을 한다고 할 수 있습니다. 수의사가 하는 일은 매우 다양합니다. 첫 번째, 반려동물 진료 분야에서는 개나 고양이 같은 반려동물을 치료하고 예방접종을 합니다. 둘째, 축사원 및 공공수의사는 가축의 질병을 관리하고 안전한 고기나 우유 같은 식품을 생산하도록 돕습니다. 셋째, 연구나 제약 분야에서는 백신이나 신약을 개발해 사람과 동물의 건강에 기여합니다. 넷째, 야생동물 혹은 동물원 수의사는 다친 동물을 구조하고 건강을 회복시켜 자연으로 돌려보냅니다. 마지막으로 특수 그리고 해양동물의 분야에서는 돌고래, 파충류, 조류 같은 다양한 동물을 돌보는 일을 합니다. 저는 현재로서는 반려동물 진료 분야에 소동물 치료를 하는 분야를 생각을 하고 있으며 호주 혹은 캐나다에서 수의사가 되는 것을 목표로 두고 있습니다. 우선 호주에서는 수의학 박사나 박사 과정을 이수해야 합니다. 대표적인 학교는 시드니 대학교, 멜버른 대학교, 그리고 퀸즐랜드 대학교 등이 있습니다. 입학을 위해서는 고등학교에서 생물과 화학의 성적이 매우 중요하고 IELTS 7.0 이상의 높은 영어 실력이 필요합니다. 졸업 이후에는 호주의 수의사 협회에 등록해야 하며 일부 주에서는 인턴 과정을 거쳐야 본격적인 수의사로서 활동을 할 수 있습니다. 두 번째로 캐나다에서는 수의학 박사, 즉 Doctor of Veterinary Medicine, DVM 과정을 이수해야 합니다. 학업 기간은 약 6에서 8년 정도 걸리며 대표적인 대학교는 갤프 대학교, OVC, 그리고 세스케추원 대학교, 캘거리 대학교 등이 있습니다. 입학 전에는 생물, 화학, 물리, 수학, 영어 과목을 이수해야 하며 IELTS 7.5 이상의 매우 높은 영어 성적이 요구됩니다. 졸업 후에는 네이버, 북미 수의사 자격 시험에 합격해야 면허를 취득할 수 있으며 각 주의 수의사 협회에 등록해야 합니다. 전 이렇게 수의학에 대한 저의 진로를 갖고 위해 캐나다의 구엘프 대학 수의대학교에서 소동물 수술을 가르치시는 윌리엄 허거 교수님께 이메일로 인터뷰를 부탁드렸고 감사하게도 교수님은 매우 흔쾌히 승낙해 주셨습니다. Hello, Dr. Hawker. Thank you so much for taking the time with me today. My name is Xian Lauren Kim, and I'm a rising ninth grade student from Korea who hopes to study veterinary medicine in the future. I'm especially interested in the GVM program at the University of Guelph, and especially in small animal surgery. So I'm really excited to learn from your experience and insights. Can you tell me a bit about yourself?
Yeah, sure. So originally from Australia, actually. So kind of I've moved across the globe. But yeah, originally graduated from vet school in 2012 from the University of Sydney, and then worked in general mixed practice in Australia for sort of 8 years or seven years or so, and then decided to pursue kind of the surgical side of things. So moved to Canada, so the Ontario Veterinary College, and then completed a rotating internship there, and then did a 4 year residency, and then am now assistant professor in small animal surgery at the university. So yeah, I've kind of done my second part of my career more in North America.
Okay. Wow, I can already see that the career you've taken is truly amazing. I actually have a few questions for you today. The first one is, what inspired you to pursue veterinary medicine, and why did you choose to specialize in small animal surgery?
Yeah, great questions. So the first one, I think that was something that I chose fairly early on, probably like yourself, being at sort of being at school, and it was something that I'd always had an interest in. Have a lot of family members in the medical profession. So my mum's a doctor, and then my uncle's actually a vet as well. So I kind of had that medical background in the family, and grew up surrounded by a lot of animals as well. So always had kind of a menagerie of pets, and was always fairly passionate about animals, and so it was just sort of something that came about fairly organically, I suppose, and was something that I'd always considered pursuing. So I had my sights set on that from a fairly early age. And then in terms of pursuing small animal surgery, as I initially went into kind of general practice, and it wasn't until I started working in general practice that my passion for surgery sort of started to develop. So, we were in a relatively remote area, didn't have that much access to referrals, so we're doing a lot of surgery there, and over time kind of built up my own skills, ended up doing some postgraduate study in Australia, which kind of fueled my interest and passion even more, and then decided to kind of pursue it, to make it my entire career, which has been great. Honestly, love what I do now at the university. So, but that took a little bit of time for me to realize that that was kind of the area of veterinary science which I wanted to be focused on, I suppose.
The second question is, I know that the University of Guelph has an excellent reputation, especially in their DVM. From your perspective, what do you think makes the DVM program their standout compared to other veterinary schools?
Yeah, I do think the school has a very, very strong program. I really think one of the strengths of the OVC in particular is it is a really international workforce. So, throughout the faculty, we have a pretty mixed bag in terms of people who have come from all over the globe to work there. So I think the fact that it has such a great international reputation then attracts people from all across the world in terms of wanting to work there, do their research there, and then that sort of trickles down then into the quality of the program, the teaching that's provided there. I think the school in itself has a long tradition of teaching, research, and has sort of committed a lot of time and energy into maintaining that over the years as well. So I do think it's a great school. I think the program is very, very strong, and also sort of from a completely academic perspective as well, beyond the DVM program. I feel like they're very supportive of research and clinical research positions, which is kind of what I do essentially.
Okay. And thirdly, what qualities or skills do you think that are most important for a student to succeed in the DVM program?
Yeah, that's a great question, because I think every individual is so varied, and I would struggle to say there's sort of one type of person that makes you have to fit this specific mold to make a great vet. I think there's so much room within the profession for sort of a variety of personalities as well. But I do think resilience is very important. It is a tough program, and then certainly once you graduate as well, the work, intellectually it's hard. It's often long hours and things as well. So, I think you do need a degree of resilience, and you can deal with some very challenging clinical scenarios. I think communication skills, are very, very important for most of what we do in veterinary medicine. So, there are certainly areas where that's less so and less client-facing roles, but particularly for surgeons and things, I think being able to communicate strongly and effectively is very, very important. And I think probably being able to work in a team is hugely important as well, whether that's in a general practice or, now kind of working in a purely surgical role. I'm a very small part of the team ultimately that makes, things successful. So we have, anesthesiologists, emergency critical care specialists. So all my patients go through a variety of specialties, in conjunction with kind of the surgery that they get. So it really does take a large group of people to make these procedures successful.
Next, in your own practice, what do you find most fulfilling about working with small animals in surgery?
Yeah, I think just is such an interesting area, particularly small animal surgery. I feel as though we have the benefit of being fairly closely aligned to a lot of the human medical sciences. So a lot of what we do surgically is not dissimilar to what they're doing in people, and so there's a lot of translational sort of research that goes on and information that's passed between the two fields, the medical fields and the veterinary field. And so I find that very, very interesting. And I think just the scope of what we're able to do, in small animals is phenomenal, and the procedures themselves are very, very interesting. So that's kind of what drew me to that, specific area, I suppose.
I understand that you've done research in orthopedic implants. Could you share a little bit about the problems you're trying to solve and the potential impact on animal health research?
Yeah, sure. So my graduate degree. So when we do a residency at the OVC, you do what's called a DVSC, which is a graduate degree. And so my thesis for that was looking specifically at what's called locking head inserts in orthopedic implants. So it's really looking at the biomechanical properties of implants and how we can alter their behavior so that when we apply them in a patient, we can give them the best chance of success. So, obviously, whenever we put a implant in a patient's leg, if there's a fractured leg, we're relying on that implant to remain in place until the leg heals. And all these implants are metallic, so yeah, typically stainless steel, also titanium is quite common as well. And you think of any metal, if you stress it enough, so if you bend it over and over and over and over, it'll eventually break. And so it's very important that when we place these implants, we're using appropriately sized implants. We're placing them appropriately to essentially allow the bone to heal before the implant breaks. And so we always say it's a bit of a race between the implant breaking and the bone healing. In complex fractures, that can be very difficult because we're asking a lot of those implants. And so where my research predominantly focuses in relation to that is how can we change things or alter things with these implants to improve those biomechanical properties to perhaps put things more in favor of the implant so that we have better surgical outcomes.
Looking back at your clinical and research experience, what has been the most memorable case or project that you've ever worked on, and what did you like learn from it?
Hmm. Yeah, that's a good one. We have some very interesting cases that come through the university. I would say some of the more memorable ones we've had over the years have probably been exotic cases that have come through. So there was an exotics department at the university that sometimes we'd assist in surgeries with them. So we've had things over the years like a lion that came in that had eaten cardboard, that needed surgery, a sea lion at one point that we needed to do surgery on. There's been various penguins and things like that as well. So those were all fairly memorable. I think probably in terms of the surgeries, like the more standard surgeries that we do, some of the minimally invasive surgeries for me are what really stand out that we do less commonly. So thoracoscopic or laparoscopic procedures I find can be very, very rewarding. And then probably a case that we did quite recently actually that kind of stands out that went well was a dog that had a very, very large adrenal tumor that was extending all the way up the caudal vena cava, which is the main venous return to the heart. So to remove that, we actually had to occlude the venous return to the heart for kind of 10 minutes to remove this tumor and then suture that back up. So I always enjoy those cases because that again takes a huge amount of teamwork from the anesthesia team, the emergency critical care team, and that dog's ultimately done very well. So I think those sort of cases always stick with you.
Um, how do you see the field of small animal surgery evolving in the next 10 to 20 years?
Yeah, I think there's a huge amount of scope for growth. I think particularly amongst the minimally invasive field, we're definitely kind of catching up with our human counterparts with that. So I think probably the field of things like robotic surgery is very, very minimally used at the moment in veterinary medicine. So I say we're definitely doing a lot more laparoscopic, thoracoscopic procedures now. So keyhole surgery, which has been the case in humans for quite a while now. But now in humans with these, Da Vinci robotic machines, there's more and more robotic surgery. There's the potential in human surgery now that maybe your surgeon isn't even in the same country or the same room. That's something that in the future, may be occurring. And so I think there is scope for that in veterinary medicine as well. It's always just a matter of funding. And, obviously we don't have the same level of funding as the human medical field, just given the degree of government money that goes into human healthcare. So there is always a little bit of a lag, but I think that will catch up with time. And then I also think there is quite a lot of scope for even artificial intelligence driven technology in the surgical field. That's obviously a very hot topic at the moment in terms of how can this aid us, particularly in helping to predict surgical outcomes, helping to aid the surgeon during surgical procedures to perhaps minimize surgical errors and things like that as well. So I think technology is probably going to be the biggest thing that drives change for us in the next 10 to 20 years, and it will probably move faster than I'm able to keep up with it. So then the next generation of surgeons will come in and probably be, as I'm getting old, will probably come in and take up the mantle on that as well.
Finally, as someone who is still in middle school but very passionate about veterinary medicine, what steps should I start taking now to best prepare for this path?
Yeah, so I think getting some experience in the industry, if you're able, is really, really helpful. So if you're able, if you have a local clinic or somewhere that is able to allow you to come in kind of as a volunteer or even do, a little bit of part-time work, I think getting that experience or hands-on experience is really going to set you in good stead for the veterinary program to just get a sense of how things work and give you a little bit of clinical background and a little bit of an understanding of all of that. It's also super helpful, in the DVM programs in anywhere in North America. They're all postgraduate degrees, and so if you are looking specifically at coming somewhere in North America to study, they do look very favorably upon, that work experience within the industry. So that's kind of the stuff I'd be focusing on right now is, you know, just kind of trying to get your foot in the door, get a little bit of experience with some local clinics, see what it's all about, and then obviously just focusing on your studies and things as well, in terms of grades and things. But ultimately, if you're doing an undergrad degree at university, then that's going to be kind of the grades that matter more to then get you into the DVM at the end of the day. But it is a competitive program, so I think if you can start some of this stuff now, it will put you in a really good position later on.
Um, Finally, what type of undergraduate degrees would you recommend to a student who wishes to study the DVM program?
Yeah, a lot of people do kind of biomedical based degrees, or like animal bioscience type degrees. So I think any of those are very, very reasonable. Yeah, anything with kind of a science base, I think is going to be easier than to transfer across into the program. That's not to say that people have done all sorts of weird and wonderful undergrad degrees. It doesn't preclude you from moving forward, but I think probably the most standard path would be, biomedical degree somewhere would kind of be the most traditional pathway into the veterinary program.
Thank you so much for sharing your experiences and advice with me today. I think this has been a really inspiring and helpful as I think about my future in veterinary medicine. I truly appreciate your time. Thank you so much.
No problems.
Have a great day. And
Yeah, are you going to just sort of some personal questions? You're thinking of applying maybe to the program at Guelph at some point?
yeah,
Yeah, okay. Oh, nice. Okay. And what inspired you to kind of pursue vet?
I think that I've always had a huge interest in, especially in animals. So yeah, especially when I was in elementary school and now into middle school. I've always been considering the path as a veterinary professional. So
Mhm.
I think while I was researching about the types of universities or degrees that I could have, one of my um I guess sister's friends went into the University of Gulf and I got to learn that the program there is very great and very high quality. So I've really wanted to go there.
No, great. We've actually had a few of our interns last year were two of our interns were from Korea. So they're one of them's pursuing surgery. They've just gone on to do a surgical internship at the University of Florida, and the other one was interested in internal medicine. So yeah, so we do definitely get people from Korea coming across, and there's actually some great surgeons too in Korea. We just had our veterinary endoscopic society meeting in Kyoto in Japan, which I was just at, and definitely some very, very, very good small animal surgeons in Korea too, doing some very interesting things. So I'm sure you'll be able to get some great experience, in Korea as well. And then, do you think you would try and do your undergrad in North America then as well, or
I think I will try to get an undergraduate degree in North America. Yeah.
yeah, yeah.
I-
Do you live in Seoul?
yeah, I do.
So, oh, nice. Okay, yeah, perfect. Oh, well, no, great. Good on you for doing this. Is this for a school project or?
Yeah, it is.
Yeah, great. Well, good on you for reaching out and yeah, that's yeah, I think you've obviously got a lot of sort of get up and go motivation and initiative. And so I think you've got some great qualities that are going to, put you in a very good position moving forward. So yeah, I say it's good on you for kind of taking that step, reaching out. It's not an easy thing to do in grade 9. So it's been fantastic talking to you. So and if when you get to the point of it's obviously going to be several years from now, but if you ever want more advice or you're looking at the program or you want me to put you in touch with other people, you always feel free to just send me an email. I'm happy to kind of help you out as you kind of approach that next milestone.
Thank you so much. I would really appreciate that.
No problem.
Yeah, that is actually all that I've prepared for today. So,
이번에 캐나다 구엘프 수의대학교의 윌리엄 허कर 교수님과 인터뷰를 진행하면서 전 수의학이란 학문이 단순히 동물을 치료하는 기술이 아닌 생명 전체를 이해하고 책임지는 학문이란 점을 정말 깊이 느낀 것 같습니다. 교수님께서는 수의사의 역할이 동물이 생명을 살리는 것뿐만 아니라 보호자와 사회의 신뢰를 지키는 일이라고 말씀하셨습니다. 그 말을 들으며 수의사라는 직업이 단순히 치료자가 아니라 인간과 동물의 연결고리를 지킨 다리 같은 존재라는 생각이 들었습니다. 또한 교수님은 좋은 수의사가 되기 위해서는 실력보다도 꾸준함과 공감 능력이 더 중요하다라고 강조를 하셨는데요. 이 부분이 특히 인상 깊었던 것 같습니다. 저는 그동안 성적이나 지식이 가장 중요하다고 생각했지만 이번 인터뷰를 통해 진심으로 동물을 이해하고 아끼고 배려하는 마음이야말로 진짜 수의사의 시작이라는 것을 깨닫게 되었습니다. 이번 경험은 저에게 매우 큰 영감을 주었고 앞으로 수의사가 되기 위해 어떤 자세를 공부하고 노력해야 하는지 방향을 잡을 수 있었습니다. 영상 봐주셔서 정말 감사합니다.